my concern is that people are going to mental health counselors and psychologists and asking about a ketogenic diet and being scared away from it. That would be an absolute travesty if the ketogenic diet is the treatment that is going to help someone save their life or save their quality of life.
Welcome back to Metabolic Mind, a nonprofit initiative of Bazooki Group, where we focus on the intersection of metabolic health and mental health, and metabolic therapies like ketogenic therapy as treatment for mental illness. I'm your host, Dr. Brett Scher. Today, I'm joined by Nicole Laurent. Now, Nicole is a licensed mental health counselor, and she specializes in helping people use ketogenic therapy for their mental illness, but not as like a prescriber and a psychiatrist, but as someone to help them in therapy and to help them with the behavioral aspects for implementing ketogenic therapy, for maintaining it, and addressing all the different factors that come up that people need to be aware of. And now she's created a training course to train other therapists and mental health counselors to do exactly this. And as we acknowledge, there's such a groundswell of people who are interested in learning about this and experiencing it, but not enough professionals and healthcare clinicians to really help them initiate it. So we need to train more psychiatrists, we need to train more dietitians, and we need to train more health coaches and therapists. And that's the role that Nicole can really play. So I'm excited to hear about how she sees her training course fit into this training network, and to learn more about the details of it and how you can get trained if it's something you're interested in. So if you want to know more about Nicole, you can find her at mentalhealthketo.com. And our training course is Metabolic Psychiatry for Non-prescribers. And then it's got a long secondary title. It's a comprehensive training designed to equip non-prescribing professionals supporting clients using ketogenic diets therapeutically. And you can find her on Twitter or X, where she's very active at Keto Counselor. But before we get to the interview, please remember this channel is for informational purposes only. We're not providing direct medical advice or establishing a provider-patient relationship. All the information we give is for your informational purposes to take to your healthcare team. Some of it can be very dangerous if done without clinical supervision. So make sure you learn from our content and take it to your clinical team to see if it's appropriate for you. All right, so with that, let's get on with this interview with Nicole Laurent. Well, Nicole, thanks for joining me again here at Metabolic Mind.
Thank you, Brett. Thanks for having me.
Yeah, I want to learn more about this training program that you have for therapists and mental health counselors. But first, give us an idea of kind of what you do. For those who don't know you, tell us about you and how you work with people with mental health issues and with ketosis and how you bring those together.
Yeah. So I'm a licensed mental health counselor in Washington State. And I've been in private practice for over 15 years now. And the last 6 or so years of that time, I've been transitioning people to ketogenic diets as a treatment for mental illness. And it's been fantastic. So I work with people specifically on getting the macros right. I initiate and help monitor a ketogenic diet for that purpose. And then, of course, I use all of my tools as a therapist to help them make this really important and big lifestyle change.
Yeah, I mean, imagine we talk so much about how ketosis can change your brain chemistry and how it can change your neurotransmitters and how it can help with symptoms of mental illness. But we also have to remember that these are people who are struggling with their mindset from day to day, who maybe don't know what ketosis is. So I'm sure there are probably many challenges and some good opportunities, though, to help them succeed in ketosis and see how that impacts their overall health. So what are some of the tips or some of the challenges that you come across most that people seem to need help with?
Well, the first thing is learning about a ketogenic diet as a potential treatment for mental illness. There's just, when people go to a mental health professional, that's not necessarily talked about or offered. Different types of nutritional therapies or metabolic therapies for brain health is not really on the radar of clinicians. It's particularly clinical psychology, social work, counseling psychology professionals. And so the very first step is educating them about it and the different effects it has on brain health, and the underlying mechanisms that are involved. So that's the first thing. After we kind of talk about that as an option and why that might be helpful, Now, I get people who I am their fifth therapist. This is their, 12th medication, sometimes just their fourth, but they don't like the side effects or they don't feel like it's helping. And they're not satisfied with the level of improvement that they're getting from psychotherapy work. And so I'm always really surprised, pleasantly surprised at how open people actually are to learning about this as a potential treatment option. And they're quite fascinated about it, really. So I use that. And then also all the, behavioral and cognitive techniques and paradigms that I work with, emotional help. That's really helpful because this is a big lifestyle change for people. But the benefits, if someone is a responder, are just so very worth it.
Yeah, yeah, and we often hear so much about the role that the psychiatrist plays because we think about medication management and monitoring for safety, and you need to be hospitalized, and the role that a psychiatrist can play. But there's so many other roles that need to be played that a psychiatrist can't play, and I think that's the role where someone like you really shines as a therapist, as a mental health counselor, to help with so many of the other aspects. Because psychiatrist isn't going to sit down and talk to you about your macros and talk to you about what foods to eat and talk to you about behavioral techniques for succeeding in a diet. It's just they don't have time for that. They're not trained for that. So what do you envision as the team? If someone says, I want to treat my psychiatric diagnosis, my mental health symptoms with a ketogenic therapy and start a ketogenic diet, what team do you think needs to be in place for that to happen?
Well, I think that, I have my best case scenario team, and the world doesn't always work in best case scenarios, and
Yeah.
people have trouble getting access to care. But I suppose if I had my best case scenario team, it would be a dietitian or a registered nutritionist that is trained, or possibly a health coach with specialized training in the use of ketogenic diets as a treatment for mental illness. There's a lot of nuances that I didn't know about early on, that the more training I got, the more I understood that these nuances for this population really matter. So I would want someone ideally trained with that population, and a cooperative, collaborative prescriber, ideally trained in the effects that ketogenic diets can have on medication, which is, my understanding, is quite different than the usual algorithm. So there's been a lot of clinical reports and even published clinical reports showing that these people often need deprescription as opposed to additional prescriptions. And that is the prescriber's job, I would say, to figure out what's going on with that person and to understand that a ketogenic diet is such a powerful intervention that it can stop seizures when seizure medications can't. So, really, a prescriber who understands ideally that a ketogenic diet is like polypharmacy. We often talk about a ketogenic diet as an adjunctive treatment to medications and additional mental health care. And that's fine, as long as prescribers don't get that confused and think that it's not a powerful effect on a patient and their medications. So I would want a great dietitian or person managing the diet and helping the person with the diet. I would want a prescriber that is trained in how to monitor and modify medications with a ketogenic diet. And then I think the gravy, or the thing that the cherry on the top, would be a therapist that is trained in supporting someone on a ketogenic diet. So, and this is really important, and this is part of why I made my continuing education training, is because in the clinical psychology world, we are supposed to work from a biopsychosocial pillar of practice. But our biological pillar is very weak or non existent when it comes to knowledge and understanding of the biological effects of a ketogenic diet. And so, my concern is that people are going to mental health counselors and psychologists and asking about a ketogenic diet and being scared away from it, being told that they're going to get an eating disorder if they restrict a macronutrient, being told something very different because maybe the psychologist or the mental health counselor has different ideas about nutrition. Maybe they're afraid of cholesterol and fat and eating meat and different kinds of things. Well, that would be an absolute travesty if the ketogenic diet is the treatment that is going to help someone save their life or save their quality of life. And so to me, the idea that there are these droves of mental health counselors and psychologists who are just really great people who really want to help and are in the trenches that might be accidentally doing harm unknowingly because they just haven't got access to the training for this to understand that this can really be a game changer for people, that we don't have medications that do all the great things that a ketogenic diet does for our brain. And so it occurred to me that I couldn't wait around for the American Psychological Association to catch up on this because they just now finally created some continuing education around nutritional psychology, which is great. But nutritional interventions, while related to a ketogenic diet, are not necessarily the same as a metabolic therapy, right? So it was just a situation in which I needed to step into this space so that people can start to be trained and people can start to get supported in this. But a therapist is fantastic on a treatment team because there is nobody like therapists who are fantastic, I would say, but I could be wrong. We're great at helping people with that psychosocial lens, figuring out how to go to family events, figuring out what emotional thoughts and feelings and stuff that's getting in the way of them making changes that could really help them.
Yeah, so it's so important. And I think, I don't know, everybody's got their stereotypes, everybody's got their biases, but those who are sort of, I don't know, you could say against psychological therapy would say, oh, it's, some would say it's a biological condition. So you're not going to fix it by talking about your mother, right? And they'd sort of poo-poo it. Like that's what they see it as. But the way you just described it is wonderful. Like it's so much more than that. It's really helping someone with their adjustment, with their lifestyle, with their behaviors. And it's so much more than that and so important. So tell us a little bit about your training course then. Who's it for and how long is it and what kind of things do you cover?
Yeah. So I want to add just a little bit
Oh, yeah.
based on what you just said because it was really, really good. So there's other things that therapists do other than just help people make behavior changes, right? We are trained in helping people self-actualize. And so for many of these people who a ketogenic diet has been really beneficial and their functioning has gone up and they might even be considered in remission, many of those people have suffered from serious mental illness for many, many years and they have a life to rebuild. And how beautiful and wonderful would it be to have an established relationship with a psychotherapist who's going to walk with them through the rebuilding of that and what that looks like. People get ideas about what they are capable of when they have mental illness that are accurate while they're having symptoms, but are no longer accurate when they recover. And so an exploration has to kind of occur about what they're capable of and what their life could look like. And so there's really a lot of beautiful work that happens in psychotherapy with my patients who are recovering or recovered and are rebuilding their lives. And so I just think that that's another really important component of it that might get lost. And then also there's the piece where it is normal for people to use a ketogenic diet to recover, and then something might happen where they go off of the diet, or even if they don't go off of the diet, there can be a huge stressor that causes a metabolic disruption or a need for additional medical care and not that I provide that, but symptom tracking, right? And so sometimes it's they go off the diet, but sometimes not. And that can be really helpful to go to a psychotherapist, even if it's once a month for a while after they feel recovered, just to kind of provide that extra support.
Yeah, wonderfully said. Yeah, very well said.
Yeah.
So there's a lack of trained everybody, right? Lack of trained dietitians, lack of trained psychiatrists, lack of trained therapists in terms of ketogenic therapy. Now it's improving,
Yeah.
It's improving slowly. We just had the first Metabolic Psychiatry Continuing Medical Education Conference, which we were both at, which was wonderful at Ellenhorn out in
Mhm.
Cambridge. And to see the number of clinicians interested in showing up to get trained was wonderful. And as part of that conference, we heard about your training course. So tell us more about your training course here.
Yeah, absolutely. So my training course is for psychologists, counselors, mental health therapists, social workers, and other allied mental health professionals that are non-prescribers that want to learn how to ethically and professionally support people on ketogenic diets, clients and patients who come into their office asking about it, wanting to learn more about it, wanting to understand the effects, and how to therapeutically support them on that journey and see the target as helping them maintain the ketogenic diet as a biological treatment for mental illness. So there are there's some great trainings for how to initiate and manage the diet, and that's very specialized. But my training program is specifically about the professional roles, how to stay within your professional boundaries in order to help people, and then, of course, the ethical piece. And when you talk about training, I think we need an absolute army of therapists who know how to support and encourage people on this treatment. And in addition to my own training program, I'm also working with other professionals to create training programs. So I'm working with someone in the Netherlands who provides health coaching on ketogenic diets, specifically, we're making a training in order to help support people using it as a metabolic psychiatry intervention and do that health coaching piece. I'm working with Jessica Ernst, who is a registered dietitian and a clinical educator at Keto Mojo, and specifically helping the dietitians that exist feel comfortable working with that population. So there's lots of great opportunities for training, and I think that there's going to be a lot produced in the next year by me and by a lot of other people who understand that the support system has to grow exponentially to help all the people that are going to want access to this treatment in the future.
Well, so let's say a therapist takes your training course, and then they're working with a patient who has a psychiatrist who doesn't know about ketogenic therapy, isn't aware of it. What role do you see that therapist playing to maybe help the patient with the psychiatrist and be part of that educational team?
Right. So most people are not getting to see their psychiatrist weekly, although, of course, that would be ideal, right? If you're early on in a ketogenic diet and you need your medications monitored for sure. But not everybody gets a psychiatrist. They get a prescriber of some sort. And so I see the benefits of seeing a therapist every week to be really, really great, really important. So like I said, there's not that many trained prescribers yet. They're coming, and training programs are coming, and I'm really excited about that because we really don't want to put the burden on the non-prescriber to be the person who is watching for potential potentiation effects or withdrawal syndromes if they're being titrated down too quickly. That's not really what we're trained in, and we really shouldn't be asked to do that part, certainly. But that
Yeah.
said, our ability to monitor and document changes in symptoms can be very, very helpful to the prescriber. And so part of my training is about how do you help the patient self-advocate with their prescriber, which is ideal to be able to have those conversations with them. If that's not working too well, how do you do a consultation with a prescriber to describe to them what you're seeing,
Mhm.
and how that might be helpful? And then, of course, how do you document as a non prescribing mental health professional trying to support someone on a ketogenic diet what you're seeing in order to have good professional practices?
Yeah, those are such important parts of the training. And, we think about clinician education as going to a conference or taking a course online, but often clinician education comes from a patient bringing something to a clinician, or from an interaction with another health professional like a therapist saying, well, hey, here's something I've learned, here's something we're working on, maybe you could try this. And that's part of what we want to do at Metabolic Mind. And by featuring people like you, by featuring the experts like Dr. Georgia Eid and Dr. Chris Palmer and so many others, and to have those resources available, so either a patient or another healthcare professional can educate others, whether it's a dietitian, whether it's a therapist, whether it's a psychiatrist. So I'm glad that's part of your training course for sure.
Yeah.
So how many credits what kind of credits can people get? How many credits? And is it only for therapists, or can like a health coach take it, or can just someone who's interested take it?
Well, someone who's interested can take it, but they would get pretty bored at the end because we actually do clinical case studies where we talk about how clinicians can use their theoretical orientation in order to pick targets for treatment. So they'd get pretty bored at the end. But the first part is super interesting because I go through a review of the literature, and that's very helpful for people. And then also we talk about the underlying mechanisms by which ketogenic diets can provide that bio pillar, that biological therapy for brain health. So they're welcome to take it, but really it's mostly for licensed mental health counselors and such, and psychologists. It's national board certified, so they get 7 NBCC credits. It is a synchronous training at this time, meaning it's live. It's a 7-hour training on a Friday, so it's an all-day thing. And that synchronous is nice because a certain amount of our continuing education credits for licensure has to be in person or online live. And so that really helps a lot of people with that requirement. And I'm also working with other accreditation providers in order to offer it pre-recorded so people can watch it on their own time. But I think it would be appropriate for health coaches that are wanting to understand a little bit more of those pieces.
And where can people go to find it? Sounds like a great course. I'm sure a lot of people are going to be interested.
Yeah, so it's available at mentalhealthketo.com. There is a resources page where it's on. You can also find it on Eventbrite. That's where they can go ahead and get it through Alley Academy Northwest. And it's titled Metabolic Psychiatry for Non-prescribers. So they should be able to do a search in Eventbrite and it should come right up.
Yeah, well, so wonderful to see this out there. And like I said, I think we focus so much on the psychiatrist and training the psychiatrist, but it's so important to train all the other health professionals who are going to be involved in someone's care, because it's more than just prescriptions and monitoring for safety. It's so much more, as you've described. So thank you for creating this course. Thank you for coming on today to talk to us about it. I really appreciate it.
Yeah, thank you. Thank you for having me.